9:57. Now, Dylan.
All right, thank you, Jeff. It is now 6:44. You can also learn something here with us, and Lee Wilson is joining us this morning from Teton Medicare to answer some of our questions, to get some of the answers. And one question that first off I wanted to ask, sometimes you hear people might say, well, doesn't Medicare cover someone enough? So why is more coverage needed?
Great question. So, yeah, Medicare does not cover everything. People assume if I've got Medicare, I'm set, I'm good. Not necessarily. So with Medicare, there's large deductibles every time you go to a hospital. You're paying 20% for every doctor, clinic, treatment, follow-up, etc. No drug coverage, and perhaps the biggest risk with Medicare by itself, there's no maximum out of pocket, which means if you've got medical bills, they can keep piling up for forever. We don't love that, right? So that's what we do, is help people look and compare Medicare supplements and Medicare Advantage plans. Today I want to focus a bit more on Medicare supplements, which a Medicare supplement, also known as a Medigap policy, two terms for the exact same thing. It's a secondary policy offered through an insurance company to help fill those gaps. So it helps pay that hospital deductible, helps pay for those doctor's bills and clinics and follow-ups and whatnot. Some of them pay almost the entire thing, so kind of nice, but there are different supplements depending on the coverage that people need and the budget that people have to spend.
All right, can you change the Medicare supplement if you need to?
Yes, so Medicare supplements generally you can change actually anytime during the year. You normally have to apply to change, which means they ask you some health questions and they can approve you or deny you. However, one change, big change for your viewers that have Medicare supplements, here a couple of years ago, Idaho adopted what's called the birthday rule, which means every year, if someone's on a Medicare supplement, they have a 63-day window following their birthday specifically, where regardless of medical, health history, whatever else, medications, they can change from one supplement to another for either different coverage or lower costs, no questions asked. So no underwriting, it's guaranteed acceptance.
So it's like your own personal little enrollment period.
Exactly right. So it's different for everybody. It's based on your birthday on the Medicare supplement specifically. That's a great time to review to make sure you're not overpaying for a Medicare supplement.
So if you need to make a change, you have to see a doctor first, or?
No, not usually. No doctors are needed. And one question we have regarding doctors a lot is, can I see anyone with a Medicare supplement? Technically, no. Close. But you still have to go to doctors and clinics that accept Medicare. So sometimes people will come in and say, well, I can go anywhere I want. Well, almost. That doctor still has to accept Medicare as the primary insurance. As long as they do, then that Medicare supplement will be accepted and cover you really well.
So let's compare Medicare supplements. Are they better than Advantage plans, or what's the comparison there?
Very common question I get asked every day. Is a Medicare supplement better than a Medicare Advantage plan? Which one should I go with? And the answer is they're both fantastic plans. Frankly, I wish I could get either one. I'm stuck on Obamacare for another 20 years. They're both great plans. It just depends on what people are looking for. There are pros and cons to each. But again, it's important to talk to an independent broker like Teton Medicare, where we can say, here's exactly how they work, how they compare, what they cost, and what are your needs, Dylan, versus anybody else, right? So that's kind of how we help people know really what's what and make sure they get their retirement right and the best coverage for them.
All right, excellent. Answers better than YouTube. All right, thank you, Lee. We appreciate your time. All right, let's take a peek outside.